Hi guys, welcome back to my channel. In this video, I would do a short review on the hematologic disorder in pediatrics. So we're going to talk about epistaxis, iron deficiency anemia, sickle cell anemia, and then hemophilia. So the first thing is the epistaxis. So it's like a fancy term for nose bleeding, right? So this one, the risk factors are given. Could be trauma, could be also caused by underlying conditions such as von Willebrand disease, hemophilia, idiopathic thrombocytopenia, purpura, or leukemia. And then assessment, of course, is going to be a bloody nose, active bleeding, and then restlessness and agitation from of the kid. And then some nursing interventions would be maintain a calm demeanor towards the pediatric patient, then have the child sit up, and then have them hold the nose in the lower part, for at least like 10 minutes, and then also apply ice across the bridge of the nose to stop the bleeding. The next condition is iron deficiency anemia. So this one is the most prevalent type of anemia worldwide. So this one can be caused due to not enough intake of iron in kids. Also, could be like a premature birth resulting in decreased iron stores. For infants, it might be caused by GERD, pyloric stenosis. Older child could be by colitis, GI polyps, and then for adolescents, especially females, it's gonna be caused by menorrhagia. So findings would be tachycardia, pallor, spoon-shaped fingernails. So this one is like very particular, and also pica, or people are craving for non-food items such as like ice, dirt, or paper. Some nursing interventions would be providing iron supplements by age of 2 months. Again, also provide iron supplements for full-term infants by age 4 to 6 months. Also, include diet with high in iron, and if packed red blood cells are required, you just need to follow the guidelines whenever you're doing a blood transfusion. Next condition would be sickle cell anemia. This one is a disease with abnormal sickle cell. Hemoglobin S is replacing a normal hemoglobin HGBA. So the risk factors include being autosomal recessive genetic disorder, can be passed down. It could be race. African Americans are more susceptible. Individuals also with Mediterranean, Indian, or Middle Eastern descent. Some of the nursing interventions would be just promoting rest and oxygenation to the patient. Also, administer blood products, usually packed red blood cells, and monitor and report lab results, and then treat any infection and also pain management. The last hematological disorder would be hemophilia, which is a bleeding disorder that is difficult to control the bleeding. It can be either hemophilia A or hemophilia B or von Willebrand disease. So the difference between hemophilia A and hemophilia B is called the Christmas disease. It's also a deficiency in factor 9. Meanwhile, hemophilia A is a deficient in factor 8. And also it's more common because it accounts for 80% of the cases of hemophilia. Expected findings would be active bleeding, gums, also is bleeding, hip epistaxis, hematuria, and tarry stools, which means there's blood in the feces. Hematoma and bruising, also headaches, slurred speech, and decreased level of consciousness. Nursing interventions would be management of bleeding. Also, do not administer aspirin, administer acetaminophen instead. Also, administer factor replacement if needed, and then elevate the joints of the child and apply ice. Also, encourage the child to rest and immobilize the affected joints.